Good afternoon. It is 1 o'clock, so we'll go ahead and get started. Thank you so much for joining our lecture today on podiatry and diabetes featuring Cindy Neeson. We'll go ahead and get started. And just a quick reminder, if you're calling in, we'll have we'll have the opportunity for questions at the end. So I'll give you that opportunity to unmute yourself for questions. And then everybody viewing on YouTube, you'll go ahead and be able to answer in the chat and just ask your questions in the chat on what you would like to hear towards the end of the lecture. Again, we're so excited for you all to join, and I'll go ahead and get started. So welcome. So just to get started, we always want to learn from you. So if you learn anything throughout this lecture today, go ahead and take a picture of that QR code or go to that website, bit.ly/record my story to record a story of what you learned from this lecture today, or just what matters to you as you age. And then we also always have volunteer opportunities, and this time we are looking for community health mentors. So if you or someone you know is managing a chronic health condition or disability and want to make a difference in training of future healthcare providers, please reach out to us for more information. You can call our intake line at 800-757-0202 to participate. And we also have our COVID and connection and time of support groups going on. So every third Wednesday of the month from 3 to 4, you can dial in at 312-535-8110 to go ahead and get some support around this coping with COVID and connecting around COVID. We also have our diabetes education and support groups. You can always go ahead and call if you wanted to join one of our groups. And Rush Caregiver Initiative. So if you're a caregiver or have a loved one that you care for that's 65 and older, we want to have you utilize our support groups. So you can go ahead and give us a call for more information at 312-563-0350. I would love to just introduce Cindy Neeson. She has 40 years of experience as a clinical nurse specialist, focusing on adult and health, aging and health. She's an instructor in the Rush University College of Nursing and Community Health Nursing in the Senior Wellness Program, a joint adventure with the city of Chicago and Rush. Cindy is a certified wound care nurse and acted as a quality monitor for the FDA clinical trials for Demograph, a human dermal skin replacement for treatment of diabetic foot ulcers. Without further ado, I would like to introduce you to Cindy Neeson. That will be our presenter for today. You can go ahead and take it away, Cindy, and go ahead and share your screen.
Great. Thank you, Danny. And you cannot share screen while other participant is sharing. Okay. All right. There we go. All right, everybody. I'm really happy to be here with you today because nothing makes me happier as a nurse to be able to help people who have diabetes be able to keep 10 toes, 2 feet, and 2 legs. So I don't know if any of you watched a very long time ago, there was a show called Mission Impossible. And that was something that we always watched growing up with our parents. And there'd be a little tape recorder, and that tape recorder would give Mr. Phelps a mission if he chose to accept it. So I have only one simple message when I'm with you today for this next hour and 15 minutes, is I want to impart to you what you need to do, what you must do to be a protector against podiatric problems. And why do you want to be a superhero like this? Why do you want to be a protector against podiatric problems? Well, you want to prevent some very important things. You want to protect your feet from developing foot ulcers, and you want to protect your toes, your feet, and your legs from amputations. So it's a pretty simple mission. for today's talk, but it's a pretty critical mission. So let me share with you a little roadmap about how the program's going to go today. One, I want to share with you some facts and figures about diabetic foot ulcers and amputations. One, to just really stress that this is a really important problem for people who have diabetes. We also want to take a path. What is the pathway to foot problems with people who have diabetes? But I'll make sure that I put that in simple language for you so we can understand, because sometimes if we understand what the process is that is to create a problem, we're better to do the recommendations we need to do to be able to save our feet. Then I want to talk with you about the components of a foot exam. And then I want to share with you my care commandments for those people who are going to take the charge as being a superhero, as a protector against podiatric problems. So let's just start with the facts, Jack. Roughly, there's about 10 million to 26 million is the estimates of diabetic foot ulcers worldwide. In the United States, we have roughly 2.4 million diabetic foot ulcers. Diabetic foot ulcers is the #1 reason why people with diabetes get admitted to the hospital. When we think of all people who have diabetes, about 15% of all people who have diabetes will develop a foot ulcer at least once in their lifetime, and 1% of those will have an amputation. When we look throughout the world, about every 20 seconds, someone loses a limb, a lower extremity due to diabetes worldwide. And in the United States, every 4 minutes, a limb is lost due to diabetes and its complications. One very, very important issue to understand is 85% of the time, so 85 out of 100 people who have a limb amputated would have had a diabetic foot ulcer. 85% of all lower extremity amputations are preceded, or a diabetic foot ulcer comes before that amputation. And the sad thing about diabetic foot ulcers is that they tend to come back. About 40% of those will come back within a year, and a little over 60% will come back within 5 years of the first time that you had the diabetic foot ulcer. Amputations don't solve problems either. About 50% of diabetic people who have amputations will wind up being dead within 5 years after their amputation. And right now in our country, diabetes is the leading cause of non-traumatic amputations for all people in this country. So the statistics are really staggering, and the cost of this problem is estimated to be $1.3 trillion. So what is the path that happens with foot problems in people with diabetes? We're going to talk about a couple of terms that you may or may not have heard before, but when we see the word path in a word, at the end of a word, that stands for either disease or suffering. So the pathway to foot problems with a person who has diabetes can be threefold. It can be a path that's related to angiopathy, which I'll tell you what that is in plain language. The path can be a neuropathy pathway, or it can be an infection pathway. So let's talk a little bit about the angiopathy pathway. So what actually is angiopathy? Angiopathy is just blood vessel disease. It can be in our big blood vessels, which can be big blood vessels in our legs, like on this slide where this person has poor blood flow to their feet and to their toes. It can be the big blood vessels in our heart, and it can be the big blood vessels in our brain. We can also have blood vessel problems when we have diabetes that can be in those tinier vessels, which can affect our kidneys and can affect our eyes and can affect our nerves. So why is angiopathy or problems with blood vessels such a problem in people who have diabetes? Well, the changes that happen is our blood vessels, which carry the blood and the nutrients throughout our whole body, they become calcified or they become hardened and they shrink. And they're not as flexible as they were before they had this problem with angiopathy. And when our blood vessels become not so flexible, they harden, they shrink. And when the insides of those blood vessels, the lining becomes damaged as a result of diabetes, we have problems with blood flow. And when we have problems with blood flow, we can increase our risk of having an ulcer. We can increase the risk in this person's case that it looks like they have a gangrenous toe. They have gangrene on the toe. It also can increase our chances of having an infection when we have a wound or a break in our skin. And it also, when we have a wound, can make things so much slower for wound healing to take place because the blood's just not flowing there. Roughly about 20 to 30% of all people who have diabetes have problems with peripheral arterial disease or this blood flow problem that I refer to as angiopathy. So now let's take a look at neuropathy. And there's 3 different flavors of neuropathy. There's sensory neuropathy, autonomic neuropathy, and motor neuropathy. So about 60 to 70% of people who have diabetes have some degree of neuropathy. And that means when you have neuropathy, you have a loss of sensation in your feet. And if you can't feel that the sand is really hot, or that the bathtub water is really hot, or that your nephew put a Lego in your shoe and you put the shoe on and you walk around all day with that, you're setting yourself up for a diabetic foot ulcer. So we're not really sure how elevated blood sugar levels damages our nerves, but it does happen. And it happens at pretty significant frequency when we're having very, very high blood sugars chronically. So we wind up losing feeling. The nerve damage is caused by those elevations in the blood sugar. So we lose feeling, you might feel numbness or tingling, it might feel like a burning sensation, and those are all signs and symptoms of sensory neuropathy. Now, our other 2 flavors of neuropathy are autonomic neuropathy and motor neuropathy. And motor neuropathy causes the shape of the foot and the toes to change. If this is my foot, pretend this is my foot. What happens in diabetes is that we can have some muscle wasting of the tendons and the ligaments in the foot. And so then the foot can take on a very unusual kind of claw appearance to that. And then the heel will come down and put some very, very high pressures on that heel. So with this change in the structure of the foot, you can certainly tell that that would be really tricky to try to put that foot in just a regular shoe that you might get at Marshall's. We also can see that with the toes being curled up like that, we have pressure points on the top there where those hammer toes are. And then we also, on the walking surface of the foot, we see some pressure that would be in contact with the shoe. And also those toes are usually not there, and that would have a pressure point there too. We also see pressure on that heel. But due to the damage related to high blood sugars with motor neuropathy, it changes the shape of the toes and the feet. And then lastly, autonomic neuropathy is a reflection of that very, very dry skin on the other side of that slide. When the nerves are damaged due to high blood sugars, it affects the ability of our sebaceous glands and our sweat glands to secrete the oils that are necessary to moisturize the foot. So that we see quite frequently in people who have diabetes, that one of their signs of their neuropathy is this very, very dry skin. And then the last pathway that we might take is related to infection and slow wound healing. Now, there's something that happens when we have diabetes that our white blood cells, which are blood cells that are used to help us fight infection, get kind of lazy, in my opinion, or get kind of slow to move around. So we see that they just don't move very fast. It's almost like they're a sloth, if you can think of a sloth as a very slow animal. So besides moving slowly, they're also moving really slowly when they need to engulf some invading microorganisms, some germs that might be trying to get in through a break that we might have in our skin or an ulcer that we might have on our skin. So they just are really slow to work, and they're slow to get after those microorganisms or those infections that can cause us so many problems. We also know, as a person with diabetes, because of this process, the signs and symptoms that we usually see might be really slow to appear. So where you normally might have, if you weren't a person with diabetes, that your foot might be warm to touch, or it might be swollen, or it might be discolored, it might be red if you were a light complected person. We don't see those kinds of things. And infection is really important to treat early, because if you don't treat the infection, the wound isn't going to heal, and the process is going to be really, really slow. We also see in people who have diabetes, there's elevated levels of substances that cause a chronic state of inflammation. So we can't get out of a first phase of wound healing, which is the inflammatory phase, because of this condition that happens with people who have diabetes, that we have elevated levels of something that are called cytokines. We also wind up seeing that there's a decreased level of growth factors, which are really important for healing skin and healing wounds. And we also don't do that great of a job of making collagen, which is the major protein that is needed for wounds to be able to heal. So we have blood flow problems, we have nerve problems, and we have the potential for infection that can contribute to our risk for having a diabetic foot ulcer or a amputation. So let's just take a look at a couple of other risk factors that we didn't talk about yet. The major risk factor for ulceration is when your blood sugars are not controlled very well. So when you're chronically having high blood sugars, which is also called hyperglycemia. Also, we see more problems with ulcerations in people who have had diabetes for a longer period of time. We already talked about peripheral vascular, or that angiopathy, that peripheral arterial disease component of it. A risk for ulceration is if you can't see very well, you're not going to be able to do self-care activities on your feet very well, and you're not going to be able to identify a problem early. We also see more problems with foot ulcers in people who have chronic kidney disease and people who are older. So some of the more specific things that we might see at the foot is related to the neuropathy that we talked about, some of those structural foot deformities that are associated with motor neuropathy, trauma, walking around barefooted, not wearing proper shoes, calluses tell us that we have a lot of unrelieved pressure in an area. So we really want to try to minimize callus formation. We also know that people who have had a prior history of amputation or a prior history of ulceration, a sore on their foot, or an amputation are also at greater risk of having an ulceration again. And people whose ankle joints don't move very well, or their feet, just the mobility is limited, also can put them at an increased risk for diabetic foot ulcers. So there's a lot of things that come into play that can contribute to the development of a diabetic foot ulcer, with potentially in 85 out of 100 times an amputation to follow. So does that cause us to panic? Are we all stressed out now looking at those statistics and all these things that can contribute to me developing a diabetic foot ulcer or a potential amputation? I hope you're not panicked. I want you to think about how you can become a protector against podiatric problems. And one of the first ways that you go about doing that is that you have regular foot exams by a provider. So let's talk about what the features are of a foot exam. So if I'm going to do a foot exam on somebody, I'm going to do a couple of different things. I'm going to look at you, I'm going to listen to you, and I'm going to feel you. All right. I'm going to take a look at your foot. I'm going to be watching how you walk into the examining room when I see you. And we're going to talk a little bit about your history. Tell me a little bit about your feet. Have you had any surgeries done on your feet? Have you ever had an ulcer on your foot before? Have you ever had some bypass surgery to your leg to help improve the circulation to that? Tell me a little bit about that history. Tell me a little bit about your diabetes history too, and how you manage your diabetes on a daily basis. Those are some things that I want to know. I'd also like you to tell me about any pain that you might have in your feet, any burning, tingling, numbness that you might feel, or any changes that you've noticed in your feet over the past, since the last time I saw you, let's say. Then I'm going to take a look at the structure of your feet and take a look at some deformities that you have. I'm going to put some of your toes through some range of motion. I'm going to see how they move around like that. Want to see if your ankle joint is pretty mobile. That would be important. And then I'll be looking for hammer toes and bunions and things like that. Then I want to take a look, and all this is all kind of happening sort of at the same time. If I'm looking at your foot, I'm looking at your skin, I'm looking at your nails and things like that. So I'm looking for any open areas, certainly, any rashes, any discolorations. Are your toenails thick and hard? Are they very, very brittle? What's the condition of the nails? I want to be taking a good look at that. Do you have any between the toes? Really important place to look. I can't just look at the top of your foot, and I can't just look at the bottom of the foot. I need to make sure that I'm getting in between your toes as well to see if there's any evidence of a fungal or bacterial infection there. And then I'm going to be doing a neurological exam. I want to be able to evaluate that you still have protective sensation in your feet. And I'm going to show you one of the tools that I use for doing that in the next slide. I also am going to take a look at your leg to give me some evidence about how the blood flow is in your leg. So I'm going to be taking either I'm going to use a temperature measurement device, or I'm going to use my hands to see how the temperature of your foot and your leg is. I'm going to be evaluating your pulses, both the pulse in the top of your foot and the pulse in your ankle. And depending on how good those pulses are, I might work my way up to the pulse behind your knee and then to the pulse up in your groin. I'm going to be looking for any hair, if I can see some hair that's still growing on your big toe, or does it look like you have decreased hair in your lower extremity. I may decide to elevate your leg and see if your leg becomes pale when it's up, and then when you hang it at the side of the examining table, if it gets red, that's kind of an indication telling me that you do have some blood flow problems like that. I'm also going to, if you haven't taken your shoes and socks off before I see you, I'm going to watch you navigate that, and I'm going to take a look at your shoes and socks to look at the wear and the condition of your shoes and your socks. Another thing that I might do, and is actually something that you could do at home, which is kind of an interesting thing to do, is the every picture tells a story. So what you do, or you have somebody in your household help you, because I don't want you to be hurting your back, because you need to be standing up when you do this. You're going to take a piece of paper and standing up in your bare feet, you're going to trace your foot while you're standing up. So this is my foot. And then you are going to get the pair of shoes, or couple of pairs of shoes that you wear regularly. And you're going to put your socks and shoes on and put the shoe on, and you're going to do that same thing, and you're going to make a tracing. So this, believe it or not, compared to my foot, is a shoe that I actually wear pretty regularly. And then I found a pair of shoes that actually hurts my feet and drew that. So what you wind up doing is you take your foot and then you take your shoe and you put your foot in the shoe, and you notice if the shoe fits, you should actually wear it. So in this case, this is a pretty good shoe for me. It looks like all of my foot fits in there. On the other hand, I'm so old school. Danny already told you I've been a nurse for 40 years, so that's why I'm doing show and tell here. This one looks a little problematic. It looks like I probably should not be wearing this shoe most places. So that's just an interesting thing that we would be able to do. And then I'm already starting to think about, wow, this person has some significant feet problem besides being a diabetic. You know, it may be a good opportunity to refer them to a person who specializes in feet. So some of the tools of the trade that I might use, one is the monofilament, which is just a nylon monofilament that, with your eyes closed, I'm going to go over different areas in your feet to see if you're able to feel that. And you're just going to tell me with your eyes closed, yes, that you can feel it when I'm going around different places on the foot. So that's the monofilament test. And not being able to feel the monofilament means that you've lost protective sensation. So it's critically important for you to become a very significant protector against podiatric problems. Another test, which I don't have my Doppler with me today, but on the top, where that little probe is on the top of the foot, that is something that we do on occasions that's called an ankle brachial index, where I'm going to listen and get the ankle systolic blood pressure, and then I'm going to use the probe on your brachial artery, where we always check your blood pressure normally in your arm, and then do a mathematical calculation. And that gives us a determination in some people that you may have peripheral arterial disease. So it's an indication of circulation. Now, the problem sometimes using Doppler and calculating that ankle brachial index is that for quite a few people who have diabetes, their blood vessels become calcified, and the results that we might get might be artificially elevated and sounding kind of normal. So we probably need to do some other diagnostic tests for blood flow based on our assessment. And then the last tool that I'm going to use, I'm going to evaluate you for vibratory sensation using a tuning fork. Vibration actually is the sensation that is lost before the results of the monofilament test. So I would be doing this at the base of your toe, and then depending on if you could feel it on the toe, I would work your way up. And this is just, it just feels like a vibratory sensation there. And that actually is lost first. So that is an important tool of the trade for those of us who work to save people's feet who have diabetes. There's also a test that you would be able to do at home, which is actually called the Ipswich toe touch test. And that you can have somebody help you do that at home. And you're going to just light as a feather, have someone in your household, you're going to touch your toes on 3 toes on one foot, 3 toes on the other foot. And you're going to see if you're able to feel that. So the touch is as light as a feather and very brief. You're not pressing, you're not poking, you're not tapping. And that's just kind of an interesting way for people at home. Somebody else has to be doing it to you, because if you're touching your own foot, you're going to have you're going to know that you're doing that most likely. But that's kind of an interesting way to evaluate sensation in your feet and to be able to do that at home. You also can get monofilament, and somebody can be doing those things for you at home too, as a self-exam if you would be so inclined. So what do I see as the care commandments for protectors against podiatric problems? What are the things that you need to do in order to have happy feet, in order to have 10 toes, 2 feet, and 2 legs till the very end? So let's talk about some of those things that I think are really, really important. The first one is not to ignore foot pain. Foot pain is really important. Socrates had said, the Greek philosopher had said, to him whose feet hurt, everything hurts. And if you've ever had pain in your feet, I think you would agree with Socrates and his statement. Foot pain is really, really important if you're a person who has peripheral neuropathy and you don't have sensation. New foot pain is a warning sign that something not so good is brewing inside of your foot. So you don't want to ignore foot pain. You want to make sure that you see somebody and you tell somebody about that. And this little cartoon says, 2 angels are in heaven, and they said, whenever I complained that my feet were killing me, no one believed me. The second commandment is no bathroom surgery. Don't run out to the drugstore and buy callus removers, corn removers, any type of chemicals like that. If you actually read those package inserts, they're going to tell you that if you have diabetes, you really should talk with somebody else before you would put these products on your feet. I found an interesting story by a podiatrist, Dr. Mark Hinkies, who talked about a new patient that he saw, who was a 79-year-old gentleman who's had type 2 diabetes for a long time. And the gentleman had said he was just trying to trim his toenails and he just didn't know what happened. He was using a razor blade, and all of a sudden he saw something laying on the floor in front of himself, And what he thought he had done was trimmed the big toenail. What he actually did was cut off the tip of his big toe. He realized he had cut off the top of his toe and then realized that he didn't even feel that he had done it. So this particular podiatrist recommends that he would like to revoke the license of all people who have diabetes who perform bathroom surgery on themselves. So critically important, no razor blades on those feet, and don't use over-the-counter potions and corn plasters and things like that, because the chemicals can be really, really damaging to the skin, particularly for those of us who have diabetes. The next thing is we want to be socks, shoes, and slippers smart. So I just would have a question for you. I'd be really curious to know what is on your feet right now. Do you have shoes on? Do you have slippers on? Are you just in stocking feet? Are you barefooted? Or do you actually have a pair of socks on, a pair of shoes on, and you're listening to this Rush Generations program? So think about that. Tell me what you're wearing during the question and answer session about what's covering your feet. About 75% of people over the age of 65 are wearing shoes that are too small. Pretty staggering statistics, so that can contribute to a lot of potential foot problems that we could have. And when we go shopping for shoes, and I'm not a person who really likes to go shopping, you want to go shopping later in the day when your feet might be a little bit bigger than they start at the beginning of the day. You also want to make sure that you're going to be wearing the socks that you're usually going to be wearing with those shoes to make sure that the shoe is then going to fit. You also want to make sure that when you wear shoes, you always want to be wearing socks with them. It's also a really good idea that you don't always wear the same shoes every day, that you kind of mix it up a little bit, that you wear a different pair of shoes on different days, just to have some different pressure areas. They all fit a little bit differently, and it's a really good recommendation to have. You want to be wearing clean socks every day. That is really, really important. You also would like to maybe be wearing either a sock that has a white bottom or white socks. So then when we talk about doing your looking at your feet every day, you might be able to pick up that, oh gosh, there's some blood on that sandal, or there's some drainage on that sandal. So then you would take a better look at the bottom of your foot. So it can let you know that a problem is happening, particularly if you're not a person who has protective sensation anymore. Sometimes it's a really good idea, because when you think about slippers, I mean, slippers are kind of comfortable. Sometimes they're not the most supportive for our feet, that when you find a good pair of shoes, you might want to consider having one of those pairs of shoes be your indoor shoes that you would actually be using as your slipper in the house. And then you would keep that pair of shoes either by the front door or by your bed, that you'd always be wearing something on your feet when you were in the house that was protective for you. You always want to be wearing shoes that are going to cover your heels and your toes. You don't want to wear sandals or flip-flops with the thong between the big toe and the middle toe. Shouldn't have heels higher than 2 inches, but you don't want really, really flat shoes, because you want to be able to have some arch support there. And I found this interesting quote from Ella Fitzgerald, who had both of her legs amputated below the knee. And the reporter had asked her, so why do you think this happened? And she said that I really like to wear pointy evening shoes. So shoes are really, really important as a foot and toe saving intervention. So when we take a look at this little picture of the shoe, better to have shoes that have laces or maybe they have that Velcro strap that can go across that could accommodate if our feet swell a little bit. The toe box, which is at the front of the foot, if you think back to that motor neuropathy slide where the person had the structural changes of their foot, you want to make sure that that toe box in the front of the foot is tall enough to be able to accommodate that change in the shape of the foot. Non-skid soles, very, very important. Let's say light colored socks, really, really important because that can help us identify if we've got some kind of trouble brewing down by our foot. And there are some vendors who actually have special socks for diabetics that'll be more padded at the bottom. You want them to be able to absorb moisture, your socks. So cotton socks are really, really good for that. Some of these diabetic socks provide a little extra thickness at the heel area and at the ball of the foot. So those might be some things that you would like to consider in order to be shoe, sock, and slipper smart. It's also really, really important that you don't walk around barefooted and stocking footed. Critically important, especially if we have a loss of protective sensation and have neuropathy. It is way too easy to injure yourself and you won't even know that it's happened, sort of like that gentleman who had cut off part of his toe when he was trying to cut his toenails. I have a colleague in Florida who shared a story with me about a client she had who had diabetes and had bad peripheral neuropathy. And she had been working with him for a very long time, talking about the importance of always wearing shoes and looking at your feet and doing all those kinds of things. And she went over to do a home visit. And when she knocked on the door on the white tile floor, there were bloody footprints. And those bloody footprints were from this person had walked on the hot sand barefooted, didn't know how hot the sand was, and came in the house and had these bloody footprints. I had a client that I saw who was a very excellent seamstress. And when I was examining her feet, I found a needle and a thread in the bottom of her foot. And I had asked her, so what are you sewing right now that is red? She thought I was a psychic or something she goes, well, how do you know I'm sewing something red? Well, the needle and the thread is stuck in the bottom of your foot. She goes, oh my gosh, I didn't even feel that. So I guess I know she was walking around barefooted at home. Cat's out of the bag. You want to be able to get regular foot exams by your provider. So really important that when you see your primary care provider, take your socks and shoes off, to have them do a kind of a quick look over of your feet. And then every year, you're going to have a more complete foot exam. And maybe more frequently, if you actually have problems with blood flow and neuropathy, or you have a history of foot ulcer or amputation. Another important thing to do every day is to do some foot and ankle exercises. There's actually been some research studies done that people who have diabetes who do foot and ankle exercises daily actually have decreased joint stiffness in the foot and in the toes. And they also have decreased pressure on the bottom of their foot when they walk, which is really, really important. So you want to, if you've had any foot surgeries before, or if maybe you have some screws or nails or anything that might have been implanted in your foot, you want to check with your provider before you would be doing any foot and ankle exercises. But they're very helpful for us to facilitate, to help blood flow, make us more flexible, help our range of motion be better in our ankle and our foot. So it can actually make our feet feel better and can be really useful in fall prevention, especially when we do some ankle exercises. So a couple of the exercises that you would be able to try if you're a person who hasn't had any surgeries on your foot is, one, with your feet, one at a time, you're going to spell the alphabet out. Cursively write the alphabet with your feet. All right, that's really good for flexibility and mobility. If this is my foot, I'm going to flex my foot back, point my toes, flex and point, flex and point. And then if this, where my other hand is holding at my wrist, if that's my ankle, I want to do some slow ankle, just focusing on the ankle to keep that ankle nice and strong, protect us from falling, and rotate the other way. We also can do some things with our toes. We can get a towel or we can get a Kleenex and we can try to grab that towel or that Kleenex with our toes. If you happen to have little kids around, hopefully their marbles aren't just laying on the floor, but you could try to grab a marble and try to put it into another container. Toe taps, tapping your toes, raising your toes, coming up on your heels, raising toes up on your heels. Just some little simple ankle exercises that can really help with blood flow, mobility, make us more comfortable, and prevent us from falling down. So if you're a person who still has sensation, your toenails are not requiring a hacksaw to cut them, your provider may say it's okay for you to trim your toenails. So if that is the case, when you trim your toenails, you want to be clipping the toenail straight across, okay? And don't cut into the corners because then we could wind up having problems with ingrown toenails there. And then the sharp edges, you're going to smooth with an emery board because sometimes, depending on what our foot looks like, if we have some sharp edges, that can be digging into the other foot that's the other toe that's right next door to it, which I have managed to do that by myself. You also don't want to be cutting your toenails too short. Those toenails are there for a reason. They're to protect our toes. And if you wind up that you need help with nail care, that they're either very, very thick, you don't have protective sensation anymore, you just safely can't get down there far enough to do that, seek a foot care provider to help you with that. And use a clipper, not a scissors. Best time to do this is after you come out of the bath or the shower, because then your nails will be a little bit softer and it's a little easier to trim them then. Another important commandment is that you want to wash and dry your feet every day. Research has shown that this commandment is probably the most effective way to be able to protect the feet in people who have neuropathy, is by washing and drying your feet every day. And then while you're washing and drying your feet every day, you're going to be looking at your feet and examining your feet for any potential problems that are brewing. So you want to make sure that you're using lukewarm water, not hot water, to wash your feet. And you're getting the whole foot, you're getting the top, you're getting the bottom, the sides, between the toes, and you're using a mild soap like Dove. You're also going to make sure that you pay close attention to drying the foot completely, and you want to do that gently by patting the skin dry, and you want to pay attention to drying thoroughly between the toes. And you want to use a really soft towel when you're doing that. So for some people, they find that if they have a hair dryer, a blow dryer, that has a nice cool setting. That can help dry between those toes pretty nicely. You just want to make sure it's the cool setting, and you want to keep it at least 16 inches away to be able to help with the drying. But pat the skin dry, don't rub it. Make sure you address thoroughly the drying between the toes, because moist skin, fungus and bacteria likes to grow on moist skin. So you want to make sure that area is really, really dry. And then, since a lot of people who have diabetes also have that dry skin associated with the autonomic neuropathy, you would like to apply a fragrance-free moisturizing cream to your feet. Get that all absorbed, but don't put the cream between your toes. Okay? And for some of you who might have really big cracks on the back of your heels, we call those fissures, products that contain 10 to 25% urea, which is UREA, can be really helpful for that. So that is the strategy for washing and drying your feet every day. Another thing that we really don't want to do is not soaking our feet. As relaxing as that might sound, to be soaking your feet in some warm water, it is really, really damaging to our skin. It's actually drying, which seems counterintuitive that soaking your feet in water would dry your skin. But it also, the moisture on that skin from soaking, like the water gets absorbed into your skin. And when the skin gets kind of waterlogged, damage from friction and shear happens much more easily. So soaking your feet can also allow small openings in the skin, cracks in the skin to open up once that skin is getting weaker because it's been waterlogged. So you really don't want to be soaking your feet. All right, let's talk about kind of what I would do when you would come in to see me and I'd be taking a look at your feet. What are the things that you need to do, which you would do at the time that you're washing and drying your feet, is that you want to take a look at your feet and take a look at your footwear every day. So you're going to be looking at the skin and the nails, top and bottom and between the toes. You're certainly going to need to have good lighting and a mirror to do that. And you can go to the dollar store and get a mirror. And then there are some products that actually you can put the mirror on this handle that comes with it. So that way, while you're sitting up in the chair, you can be looking at the bottom of your feet. You can be looking at the top of your feet. And it also comes with some brushes and some sponges for you to be able to wash your feet. So that's kind of a handy thing if mobility is a bit of a challenge. The good light in a mirror can really save the day when we're trying to inspect our feet. So you're looking for any color changes, temperature changes, any swelling. You want to be looking for any open areas. Do you have a new blister? Does the callus look different to you? Or do you have a new callus that is formed? Dryness, rashes, anything like that. And you want to report any changes that you find in your feet, and you want to do that right away. A rather ominous sign that you want to call somebody for right away is if you would notice on a callus that you have, let's say you have a callus on the bottom part of your foot, and you look at it, and today it has some blood in that callus, or little specks, maybe a lot of blood, or just a little bit of flecks of blood there. That is an ulcer waiting to happen. That hemorrhage into that callus is a very ominous sign, and you need to let somebody know that right away. It's also important that you take a look at your footwear. And this was the shoe of a client that I had saw that had a nail in the bottom of his shoe that he didn't know was there. So really, really important to take a look at that. And also before you put your shoes on, it's a good idea to stick your hand in there and feel if there's any rocks or anything, or a grandchild's Lego got mysteriously put in your shoe. So you won't be stepping on any foreign bodies that you might not know that you were stepping on because you don't feel things anymore in your feet. So perhaps the most significant commandment that we can embrace as protectors against podiatric problems is this one. And that is keeping your blood sugars under control and managing your other health conditions. So keeping your blood sugars, hitting your blood sugar targets, hitting your blood pressure targets, hitting your blood cholesterol, blood lipid targets, and your weight targets is probably the most important thing that we can do to prevent diabetic complications like foot ulcers and amputations. So I certainly want to thank you for spending part of your day with me today. And Rush Generations, this certifies that you are a protector against podiatric problems, and you have been armed with the information you need to save your toes, your feet, and your legs. I wish you a very happy holiday season, and we will answer any questions that you might have. And here's a couple of resources for you. Thank you very much.
Thank you so much, Cindy. That was so beneficial. And I know our members have gained a lot from today. I did want to go back to the question. So I did put it in the chat on
Okay.
what are you wearing on your feet right now? So some responses were gym shoes. If you wanted to talk more if that's a good thing or a bad thing. Slippers, loafers, and socks.
Oh, just socks?
Just socks.
Okay. Well, good. I appreciate that honesty. And I will tell you, I'm wearing socks and slippers.
Good. I'm wearing heels.
Oh, no, Ella Fitzgerald.
I know. So that does go into one of our questions that we have since we're talking about heels. So if someone does wear heels on occasion, is there a time limit?
Well, there's a height limit. 2, try to make it chunkier. The chunkier the heel, the better. And make sure that when you purchase those heels, when you're in the store, that they actually feel good on your feet when you buy them. I'm notorious for buying dress shoes like for a wedding, and they're killing my feet before I even go to the wedding, and then my shoes are off underneath the table. And then you want to break them in slowly, just wear them for, an hour or 2 before you're going to have this big event where you need to wear those heels. But really, the chunkier the heel, the better, and try to limit the height of the heel to 2 inches or less.
Perfect. And then I will also let the callers that dialed in, if you have a question, feel free to unmute yourself by pressing *6, and you can ask Cindy a question as well. So I'll give a couple of seconds to see if they have any questions, and then we'll go on to the rest of the questions in the chat.
Sure.
Okay, so we'll go ahead and go on to the rest of the questions in the chat. Another one was, can you explain more about wearing light color socks versus dark color socks?
Sure. Light colored socks are helpful for us if we're going to have a problem on our foot. Let's say we had a sore on our foot. That would help us identify that there was maybe some drainage where we might not be able to feel it, that we would see the staining on the sock. So it's kind of sort of another helpful thing for us who don't have sensation on our feet to be able to appreciate that there might be a problem. Because let's say you did your washing of your feet, you looked at your feet, everything was fine. And then you went to Millennium Park and you were walking around all day. And since you don't have sensation, a rock had gotten into your shoe, or maybe there was just some wearing since you hadn't worn shoes that long because it's a pandemic and we haven't been out and about in such a long time. And you already looked at your feet, everything was fine. But then when you take the light colored socks off, you notice, oh my gosh, I got blood on my sock. What's going on there? So it's just kind of like a little bit of a trigger for you to notice something that might be happening in your foot that you might not have necessarily felt.
Awesome. Thank you for that. Another question. Why is it important to look for hair on my big toe during an exam?
Sometimes the lack of hair on the lower leg goes away when we have blood flow problems. And sometimes it just goes away because we're getting older. But usually that hair on the big toe will stay unless we have circulation problems. So that's why I was looking for hair on your big toe.
Awesome. That's great to know. Okay, next question. So when you're doing the shoe drawing activity, should I just do that when I purchase a new pair of shoes, or how frequently should I do that?
I think I would, I'd be curious. I was just curious for myself, particularly for that pair of shoes that, I really like, but they don't feel very good on my feet. You might even want to take it with a couple of shoes that you already have in the house to see how well the shoe fits or not. It's just kind of an interesting thing to do. You could actually draw your foot before you go shoe shopping too, and bring your foot with you, have 3 feet with you, and bring the picture. And then
that'd be good.
try that shoe on too, besides getting, making sure a person would measure you in that term. I can't think of what the thing is that you stick your foot in and they measure your width and your height and all that kind of old school kind of stuff that we usually don't do anymore. But that might be an interesting thing to do if you're in the market for new shoes, to actually do a tracing and bring it with you.
Yeah, that would be a good tool to have, especially if you're in a rush and you didn't want to try it on in the store, or prevent you from maybe having to redo all the returns and everything like that. It's a good tool. And I think there is one more question. So if I do have diabetes, will a foot exam automatically be included in my annual exam with my doctor, or should I see a specialist?
Depends on who your provider is, who your primary person is, your internist. When you just see family practice or your internist, we should, or an advanced practice nurse, we should be looking at your feet for at least a quick little overview every time. And you help us out by taking your shoes and socks off, because then we've got no excuse for not looking at your feet, because it's like, there they are right in front of my face. So if you have diabetes, I say it probably would be a great idea, especially if you don't know if you have sensation still or not, or circulation problems, that you might want to establish yourself with a foot care professional, like a podiatrist or a certified foot care nurse or something like that.
Awesome. Thank you. And we did just get another one in the chat. What do you think about foot massages?
Foot massages, I personally, I love foot massages. They're very relaxing. So if you're a person who has diabetes, I guess it depends on who's doing your foot massage, and hopefully they're not soaking your feet before you're getting a foot massage. But doing even your own foot massage when you're going to be doing those foot exercises is really good for mobilizing the foot. So I think that's, a really nice idea. It's just if you have open areas on your foot and maybe you're going to a place where you can get massages, maybe you wouldn't necessarily want to do that, but certainly to do that to yourself or somebody who's in your household who's going to be doing it to you. Feel free to include the foot massage in your daily inspection of the feet and the washing and thoroughly patting dry of the feet is great. Help mobilize that foot.
Now, what about like foot massagers, like those machines, or you can just buy them at the store and they're supposed to help with massaging your feet? What about those?
So is that the ones that like have the shiatsu?
Yeah.
The bottom of it? I think if your feet are intact and you have protective sensation, so you'd know if it was too hard on you or not, it probably wouldn't be a terrible thing for you to do for a couple of minutes, really.
Great. Those are some great tips, and definitely I think some of our members really took a lot out of this lecture today. But that does wrap up the questions. Again, I'll give another opportunity for people that called in. If you have a question, you can go ahead and dial *6 to unmute yourself and ask a question. Give you a couple of seconds.
And then I would just encourage those who are on the call, if you've never participated in this before, Rush Generations offers a 6-week series on Take Charge of Your Diabetes, which is a terrific class where you learn from other people who also have diabetes, as well as from your 2 facilitators, on how to take care of your diabetes to the best of your abilities. And just the feedback that I get from people who have taken that class, what they've learned from each other and what they continue to do after the class, because usually when I'm in a class, I do everything I'm supposed to do. And then, or you go see the physical therapist, and then I don't do my exercises anymore after I stop with physical therapy. They continue doing their action plans and what they learned in that particular class in order to be the best person that they can be, the healthiest that they can possibly be. And just what they learn from each other is so powerful. So if you haven't, or if you have and you want to take it again, it's a really powerful class to take charge of your diabetes, that 6-week chronic disease self-management class.
Yes, thank you so much, Cindy. Yes, we definitely have Take Charge of Your Diabetes, as well as Take Charge of Your Health workshops. So if you are interested in joining those 6-week programs, you can give us a call on our intake line, and that number is 1-800-757-0202. Again, thank you all so much for joining today. And if you have any questions or you think about any questions after this lecture, feel free to email us or call us. Again, our number is 1-800-757-0202. You all have a wonderful day.
Take care.